Welcome back to Architect Live on day 3 of AIA Convention 2016. I'm Ned Kramer, editor-in-chief of Architect Magazine, and it's my pleasure to introduce the next session.
10 minutes left.
Comes to you from the University of Arizona Institute on Place and Wellbeing. Yay! The presentation is titled Instantiating Place and Wellbeing into Research, Practice, Design Tools, and Education. And leading the session will be moderator Esther Sternberg, who is the director of the Institute. Take it away, Esther.
Thank you so much, and thank you for the opportunity to present to Architect Live. We are, as you mentioned, the University of Arizona Institute on Place and Wellbeing. I am a physician and medical researcher who, prior to coming to the University of Arizona, did medical research on the connection between the brain and the immune system. So you might ask, why is a physician at the American Institute of Architects? It started a long time ago, in about the year 2000, when the then Director of Research of the General Services Administration, Kevin Kampshire, invited me to help him study how place and space around impacts occupant productivity, health, and well-being. And that launched me on what is now a 16-year collaboration. You can all go to our exhibit of some of the work we're doing with the General Services Administration on studying the impact of the built environment on human health and well-being. That collaboration also led me to write a book, Healing Spaces, The Science of Place and Well-Being. And that's how I came to work with the American Institute of Architects. And I believe that Clark Manus is in the audience, and I'm about to take his name in vain because I was speaking at the American Institute of Architecture students on December 29th of the year 2009, the beginning of the downturn. The first speaker was talking about the business of architecture. And he emphasized to these fifth-year graduating architects how the business was in disarray, 50% layoffs from even the major studios. And I had to stand up and give the next keynote, and it felt like I was speaking to a funeral. So I said to those graduating architecture students, and I say that to all of you now, you, design professionals, our health professionals, partners in the health of this nation. We cannot do it without you. We need you to design healthy spaces that not only get rid of toxins, but improve health and well-being. And Clark Manus and George Miller, then presidents of the American Institute of Architects, were in the audience and came up to me and said, "You've given us an idea. We are going to get this concept across all the knowledge communities of the American Institute of Architects." And from that idea, from Clark and George, sprang many of the initiatives that you are seeing here today, the Design and Health Leadership Group, the Health and Design Research Consortium, and so on. This is the concept that we are doing. I'm not going to spend time because my two wonderful colleagues from the University of Arizona are going to talk about the kinds of research we are doing to link human health and well-being to many different environmental attributes. The University of Arizona Institute on Place and Wellbeing is a formal collaboration, a formal entity that links the College of Medicine, the Center for Integrative Medicine, and the College of Architecture, Planning, and Landscape Architecture. And I see some of the faculty here and the director. And it is an exciting collaboration, bringing in many colleges and centers and institutes across the university. We have, as you will hear in the next two talks, several main foci: curriculum development, research, instantiating into practice these principles, and community outreach and policy impact. And so I'm going to now introduce my colleague and our postdoctoral fellow, Casey Lindberg. Casey is a PhD psychologist, has a master's in architecture, and combines perfectly all of the aspects of what we need to measure the impact of the built environment on place and well-being. Omar Youssef is our graduate student, PhD student, who will show you the kinds of design tools that he is developing to measure and to help design buildings that optimize human health and well-being. So I'm going to turn it over to Casey and then Omar.
There you go.
Great, thank you, Esther. So as Esther mentioned, we have a few different branches or outreach arms within the Institute on Place and Wellbeing. And the first thing I'd like to take some time discussing are some of those challenges, but also opportunities that arise when you're talking about educating either continuing professionals or students at Arizona, whether they're architecture students or landscape architecture students or planners, some of those opportunities. And really what we're talking about is the idea of successful communication. So we have a lot of knowledge to draw from different experimental social psychologists, from psychologists, from physiologists on campus, bringing those tools together in a way to arm new students of architecture with that in their arsenal. So we're really talking about successful communication, getting away from this idea of having these local telephone calls to ones where we really have an open communication and a common language. Often the first step is asking a question or a couple questions. One of those is about what is critical thinking. And I want to propose that those of us with a more scientific background, experimental background, would argue that critical thinking is the same thing as scientific thinking. So the first step in that sort of cultural change that needs to happen is a common dialogue there. Another question that you can ask design students, and this is one that I ask classes, you can also ask continuing, practicing architects, is what is research to them? So finding a definition of a word that some of us from disparate fields sort of think that we understand and that everyone understands it from our lens is a big misconception. So trying to describe what peer-reviewed research is, what the scientific method is, where is a go-to journal where you can then disseminate knowledge among your colleagues and instantiate into practice is a challenge, but it's also a really fun opportunity to open up eyes and also, of course, learn from the other disciplines in this true multidisciplinary institute that we have. One of the interesting sort of examples, I guess, to bring this into focus here is the idea of an optical illusion. So everyone is well aware of optical illusions. You're probably aware that the sensation and the perception are not necessarily the same thing. So we're very complicated organisms. We're dealing with lots of information coming into us, and we're trying to make sense of that, trying to make patterns, trying to economize all that data that's coming in through our sensory systems. So here's a classic example where if you stare at this, especially if it's large in front of your face, you'll see little black dots appear where the white dots are. And if you're still not convinced that sensation and perception is not necessarily reality or the real world, we can take a very literal slice through the eye and show how it really has to be. So here's a cross-section through your human eye, and all vertebrates share an eye similar to this, in that if you look at the back of the retina, all your photoreceptor cells, your rods and cones and other cells that are receiving light come together on this side of the eye, not this side. So what that means is they have to gather out and go out a hole. And in that hole, you don't have any photoreceptor cells. We have a blind spot, a literal blind spot right here in each of our eyes, depending on which eye you're talking about. That's not a small hole. Yet we're always filling that in with information. We're continuing patterns that we see in our visual field. So it's a very literal example, and if you haven't done this, go online and search for a blind spot test. It's a really fun thing to do, and you can see how pretty large stimuli disappear if you're the right distance away from viewing something on a sheet of paper or your screen. So I should say on that slide, it's titled Naive Realism. That's another way of describing the idea that people assume that they're seeing things as they really are when they may not be. Another idea here that I want to talk about briefly is the word operationalize. So a lot of architects and just general people throughout the world always have personal theories about things. These are hunches. These are not scientific theories. So the first step in providing data to support a hunch would be to operationalize that. What do we mean when we say we have a nice space, a good space, a cool space? What are we actually talking about? What's the metric that we can apply to that building or that stimuli to then actually show through data that there's a difference, to compare two things? It can be as simple as, okay, here's something that's big. What do we mean by something that's big? Is it heavier? Does it take up more space? We need a metric first as the first step on that path. One of the really classic examples that's, I think, very salient with architects and designers is this idea of the golden ratio as being sort of an ideal proportion to deal with. Now, certainly there is a natural phenomenon here in that it shows up a lot in nature, in biological reality. But as far as an assumption that aesthetically this is most pleasing, that there's something ideal about this ratio, data is really lacking. There isn't really a consensus that this is a special ratio for aesthetically pleasing things. We use it all the time, we assume these things, but you have to operationalize that. Does that mean that we're going to prefer pieces of art that have this specific ratio, or floor plans or elevations that exhibit this ratio? Does it mean people like them more? Does it mean it's their first choice? And the data on this are really sort of broad and controversial. So you don't get a lot of support for the idea that there's something very special about the golden ratio in terms of human perception, which is sort of an interesting and challenging thing to probably swallow for a lot of architects that love dealing with proportions. But again, we're talking about operationalizing hunches. Another step once you operationalize something is that you can then disprove it. If you can't disprove a theory or a hunch that you may have, it's not worth anything. Then we're talking about something that's outside the realm of science. We're talking about metaphysical claims, things like that. We're not talking about something that you can actually disprove. If you can disprove it, it might be worth something. Not sure if this guy is working here. Can someone advance the slide? There we go. So again, I've mentioned this before right here, but we're talking about arming, not limiting, not prescribing anything to designers or students. We're really talking about arming them with a tool for their toolbox, something that they can use to have data to support something, whether it's health and well-being, to a client, to a teacher, to a colleague, to a fellow student. This is another tool in the toolbox that is already very large for architects, but I believe a very powerful one. And the last point here is an idea of, again, a cultural change. We want to redefine the word sustainability. If you ask design students what is sustainability, they'll tell you about all the green and energy savings methods that are out there. These are wonderful, but they're only part of the picture. The other part of the picture is including human health and well-being and their activities into that dynamic system that is the built environment. The building around us is a dynamic system throughout the day, throughout our interactions with us as humans, and we are dynamic as well. There's a synergy there. There's an interaction that we have to understand a lot better, and from the first point in design, understand that humans are part of that discussion. So it's very easy to go online. These are images from architectmagazine.com, some office space from WTL Design in Beijing. Beautiful pictures, but often you can't find people in the pictures of architecture. You can sometimes. It's still pretty rare. They're often blurry, they're transparent. It's as if we want to separate the building as a piece of art from the humans that occupy that space. And I would argue that's a bad thing, and that's part of the cultural change when we start designing these spaces and selling those spaces. One way to sort of compare that to another world is fashion. Imagine trying to sell clothes on a hanger versus clothes as being worn on a runway by models. You get a much more dynamic perception of how that space is being used, how those clothes are being used, and I think can be a powerful sort of comparison there. So I wanted to change tracks just really quickly and give basically a little bit of a shout out to a community outreach program. That was another one of the arms of IPW, as Esther explained early on. There are some design build houses that are created based on some grants. It's called the Drachman Design Build Coalition for Affordable Healthy Housing. There's a number of houses down in the Tucson area that are built with grants based on energy and water savings. And we're able to use the students at Arizona to help build these. And Professor Mary Harden is the lead architect. She's a professor of architecture at the school. And they're using a lot of indirect lighting, lots of daylighting, lots of northern-facing glazing, all sorts of cool energy-saving techniques there. At this conference, talking back to the idea of research really quickly, our flagship program that Esther was talking about, the partnership with the General Services Administration, is on display here at this conference this year. And really what we're talking about is taking physiological data streams that we can measure in real time, psychological and social data streams, and environmental data streams together for the first time. And what's novel, what that missing link is working with Acclima, our partner in this research, for the environmental sensing. We can now measure a bunch of different parameters of the indoor environment in real time and start to tie that together with these other data streams to better understand the dynamic system that we call our research program, which is Well Built for Wellbeing. And you can visit our booth, which is just over there, number 546, to learn a little bit more about that research. But let me quickly turn it over to Omar, let him talk a little bit about some design tools in visual comfort.
So as Esther and Casey mentioned, people are very dynamic. They think and react to spaces differently and very intelligently. There is a lot to that from where architects can contribute. As we see spaces, there are different effects on spaces. There are sonic, luminous, spatial, and acoustic differences in all of the spaces. How can architects utilize all of these factors as they think about design? How could they think about where are the areas where there are major contributors with the space, the environment, as well as human perception, which is a big part of it? We obviously know that the built environment has a profound effect on human perception, well-being, building operation, as well as human operation. How can we utilize that to make sure that we optimize the space performance as well as the human performance within that space? So what we're looking at right now is pretty much what we have in the concept of our booth. How can we, and what Casey talked about, how can we have the basic human environments within the space environments and use that as a basis of how we are designing the spaces? So for example, designing a space with one window and ensuring that we have adequate lighting within that space, how does that affect us being the people inside the space? Designing it with no people's perception in mind, we design it and assume that the space would have adequate lighting. However, our eye is extremely intelligent and the way it reacts to different lighting conditions is extremely fast that we don't notice. But if we take a picture with the camera, you can see the difference in all of the lighting conditions that we get from just one window and one source of light. So with that idea in mind, we are able to think about what are the design tools that we could use, what are the ideas that we can adopt, and how could we think about all of the different aspects, and how do we think about human perception within our design of the space. So one of the things that we do at the University of Arizona is we can regenerate spaces and have live 3D instantaneous computer simulation where we can walk inside the space, change locations, and be the person inside the space, so that not only render a 3D and have people inside it, but we actually are immersed inside the space and feel all of the different aspects inside the space so that we can optimize the performance of the building and people. Can we advance the next slide, please? I don't know if this is. So one of the tools that we are developing is how could we adapt the environmental experiments that we have on human perception. So instead of using light sensors to analyze light distribution inside the room, how could we draw lighting patterns and understand the light behavior from different positions of how people are interacting inside the space, so that we can understand how these light patterns affect the people inside the space, and how could we design it with optimizing light conditions, how could we optimize light distribution within the space and have the human perception as the centralized portion of it. The second thing is using fisheye analysis tools. And this was an experiment that we did, and we basically look at what are all of the blind spots that people have inside the space, and how could we optimize the different points, how could we optimize the major area that we see and how we perform inside those spaces. So if we take a look at this example, being in a hospital bed, and can we advance, please? Taking this 360 image with this fisheye lens, we can see what the patient looks like inside the room. What are they looking at inside the room? And as architects and scientists, we need to calculate all the different dimensions. We need to make this something that we are able to measure instead of being a picture. So we break it down to 1,000 images, 1,000 segments, and then take out all of the blind spots and see what are the major nodes that the patients or the occupants inside the space can see. And as you can see in this image right now, the most part that they would see being in a hospital bed is the ceiling design, which in most cases is neglected. And obviously right now, circadian rhythm and awareness, you can utilize something like this, the spatial, the ceiling space to design and optimize space that could heal the patient faster, that could provide a lot of different benefits for the patient's experience inside the space. So basically what we're doing is establishing this relationship, building the tools and establishing the relationship and building, can you go to the next one please? Thank you. Establishing the tools and applying them, testing those tools, validating how these links that are being established and how architects can use these links to think about what are the different nodes in high building performance components that could trigger the relationship between the human health and the built environment. And these are some of the tools that we've used to validate and optimize human well-being and hopefully cause a revolution in architecture, human health well-being. Thank you very much.
Well, thank you both, and I hope that you can see the transition and the continuum between understanding the physiology and psychology of the human within the space. Casey talked about blind spots and how the eye recognizes blind spots. The transition to designing tools for designers to optimize design and take into account those blind spots. That's just one example of how, by understanding what you see and hear and smell and touch and do in a space, you can design that space to optimize human health and well-being. So I'm going to turn it over to the audience for any questions. And are there any questions? If not, I will ask the two of you to maybe comment a little bit on your vision for, Casey, you talked about educating the next generation, and how might you go about doing that, and Omar as well. I think that's, yesterday in one of the sessions, a question was asked, how do we get this concept across all aspects of design professions? You have healthcare design, but there's office space, schools, at all scales, building, individual homes, urban planning. So one very important aspect is educating the next generation. And how would you do that? And I'm going to ask both of you to comment.
I think the first step, which is a very hard first step, is getting real buy-in from those different departments within a school. So we've been very lucky at the University of Arizona, being led by Esther Sternberg, to have done that. But you can't have just one person listed on a website as sort of a collaborator within your institute that, oh, they're going to bring in this entire field of psychology for us. It has to be a real buy-in between those, and then it's an issue, like I said, of communication. So having a common language where you can actually have people maybe at those intersections that understand multiple worlds and be able to communicate back and forth, because there's so much that you can learn between those fields.
Yeah, absolutely. There's a question. I completely agree with you, and I think the creating a common language between physicians and architects is a great point where we can start, and it's definitely established.
So before we go to the question, I want to make a comment, because McGraw-Hill did a survey which they reported 2 years ago, I believe, at the American Institute of Architects, where they found that over 80% of design professionals were aware of the impact of the built environment on human health and well-being. And in a national survey, only 36% of health professionals were aware of that. And as a physician, I can tell you, we are so used to running around in noisy, smelly, maze-like hospitals. We figure this is how it's supposed to be. And I know a lot of you healthcare design professionals are fixing that for us. But there's an important education that needs to go out to your clients, the healthcare professionals. So I'll take your question. Yes, you can.
I think you talked about operationalizing the knowledge of the architecture, not the building. You are always designing something with children in mind. I remember when my daughter was wheeled into the emergency room and then to a station in the hospital, and she was on the gurney and looking up, and I was walking with her, and she said, "Daddy, look at the stuff that you guys designed."
So
You're right. Yeah.
yeah, so we need to repeat the question. And could somebody please hand microphones to the people in the audience when they ask questions? But the question is, how do you convince the client that they should pay extra for this?
Right. So that you're right. That's one great example of operationalizing. There are lots of different types of operationalizing something within the scientific world. But if you're trying to convince a client, like you said, you need that ROI operationalized. So that might be something about absenteeism in the workplace, sick days, presenteeism. In hospital, it might be about turnaround. It might be in any kind of employer, it might be turnover in employees. It might be recruitment. So there are a lot of different metrics that you could use and pick and choose from. There's not one go-to, metric there. You have to use a lot, and we have to count on multiple fields to inform us about those metrics. Just because we have fancy new neuroscience, for instance, and imaging, these are great tools, but they are only as useful as they can be when they're used in conjunction with tools that we've used, like survey tools. There's a lot of great information that we have from the history of psychology research, and marrying those together into how the built environment acts as a system on us as our health and well-being is really what we're after. And that speaks back to Esther's layer cake of all the different types of input data that we're interested in.
And I understand our time is up, but that was a great question to end on. We do need the rigorous data to be able to measure and quantify the impact of each of these environmental attributes on health and well-being, the impact on the bottom line, and then we need to educate the next generation, disseminate the data to the public, to the design professions across the spectrum, and change policy. And that's what the Institute on Place and Wellbeing at the University of Arizona is all about. So I thank you all very much. Thank you to Dr. Casey Lindberg, Omar Youssef. Thank you very much.